It's a tip of the week, and today we're going to discuss hemostasis. So let's just say you're working on a patient, you're taking out tooth number 32, and you're working on it, and you recognize that you're having way more bleeding than necessary, and you're like, oh crap. Now, of course, you would already check the medical history. There isn't any blood thinners that the patient's taking, but you see a lot of blood that's coming profusely from the socket. So you got to think about it. Did you sever a large vessel? Did you hit a nutrient vessel? Or just some bleeding that's just uncommon that you're not used to? Well, there's a couple things to do. First thing is don't say, oh crap, when you're sitting with the patient. Next thing to do is just relax. First thing to do is get a gauze. Now, this is just a specific type of sponge. As it gets wet, it forms to the site. You want to have the patient bite down. Generally, the larger the vessel, the longer the time in which a patient's going to have to bite down for. I've had patients bite down for 5 to 10 minutes to close different vessels, because what that does is it causes coagulation when the vessels are being occluded. Other thing that you could do is squirt some epinephrine into the site and have the patient bite down. Generally, you would want to have 1 in 50,000. However, if you have 1 in 100,000, just add it to the area and just have the patient bite down. If you really did some damage, you're going to have to go ahead and ligate a vessel. Hopefully you don't ever have to get to that point, but if you do, these are certain things that you can do. You'd have to locate that vessel and apply. Now, however, this is more so for soft tissue hemostasis control, but just something to keep in the arsenal. Another thing to also take in consideration is this: have the patient bite and sit them up. Hemostasis is also controlled by changing the patient's position and posture. So keep that in mind as you're working with these patients. Once again, this is a tip of the week.